Hi friends, today we are going to discuss about some points in what are the laboratory tests, what are the physical findings, and what are the physiological findings, and what are the signs and symptoms which can see in pregnancy. And by seeing these signs and by identifying these signs, we can say that the lady is pregnant. So the diagnosis of the pregnancy. The most obvious symptom of the pregnancy is cessation of the period, that is amenorrhea. So the first and the most important and obvious symptom is the amenorrhea, that is stop of the menstrual cycle. A period of amenorrhea in the woman having regular menstruation. Other common signs and symptoms of the early pregnancy, that is nausea and vomiting. As I said, that nausea and vomiting is mostly due to that of increasing in the level of human chorionic gonadotropin hormone. So nausea and vomiting is also called as morning sickness. It is common in the first trimester, may occur at any time of the day, may sometimes persist throughout the pregnancy. So we have different category of nausea and vomiting. So sometimes it occurs 2 times a day, sometimes it's 10 times a day, sometimes it's more than 10 times a day. So when it happens more than 10 times a day, that is called as hypodemysis gravidarum. That is a condition where there's some negative effect on the maternal body, and it leads to dehydration, it leads to electrolyte imbalance, and it leads to the weight loss of the pregnant lady. The other sign, that is the frequency of micturition. Micturition mean the urination, okay? Because whenever there will be pregnancy and the product of conception into the fetus, into the mother body, mother womb, then definitely the size of the uterus increases. There will be hyperplasia, hypertrophy, which suppress the urinary bladder that is present anteriorly to that of the uterus. So the pregnant lady feel frequent urination. So the plasma volume, another cause that causes the frequent urination is plasma volume increases and increase urine production because GFR increases. Pressure effect of the uterus on the bladder. Make sure the frequency is not associated with dysuria, which may denote possible infection. If there is the urination is increased, but there is no dysuria, it means that may be the sign of the pregnancy. But if there is dysuria, mean pain during urination. So dysuria is a common sign for urinary tract infections. Excessive latitude or fatigue, common in early pregnancy, tends to disappear after 12 weeks of gestation. Breast tenderness by the action of estrogen hormone, or heaviness of field of the breast, often seen early in pregnancy, particularly in the month after the first period is missed. Another point, that is the fetal movement or quickening. Approximately 20 weeks of gestation in the nullipera. So what does it mean, nullipera? Nullipera is we can refer to a pregnant lady who never give a baby, that leads to the period of fallibility. That is that, for example, a lady, she has a fetus inside, and that fetus now crosses the week of 22 or 20 week of gestation. Is mean that this baby, this mom is peripera. It means she has one baby which crosses the 22 week of gestation. But if there is no fetus which cross the 22 week of gestation, is mean nullipera. Okay, so 22 week of gestation, after 22 or 20 week of gestation approximately, the mother feel the movement of baby. 18 week in multipara, and if the mother is multipara, okay, it mean that she will feel the fetal movement in 18 week of gestation. Many women may experience fetal movement earlier than this, and some may have perceived movements until the term. Occasionally, a pregnant woman may experience an abnormal desire to eat something not normally regarded as a nutrition, that such as dates. This is known as pica. So pica is a condition which normally can seen in the pregnant ladies sometime. Okay, it is a condition in which the mother want to eat some soil or clay or stone or wood. Okay, that condition is called as pica. So what are the clinical examinations we need to identify, and we need to confirm the pregnancy? That the vagina in the cervix has a bluish tint due to the blood congestion. The size of the uterus may be estimated by the bimanual examination. Okay, and this bimanual examination is performed in order to check the size also, and if the pregnancy is reached to the later stage in second to third trimester, we use the symphysis-fundal height of the uterus. Okay, and identify to height of the fetus and the size. And the another examination and another method that is used to identify the location and the lying and the position of the fetus, that is the Leopold maneuver, which is performed in order to check the fetal lying positions. After 12 weeks, the uterus is palpable abdominally, and the fetal heart may be heard using the hand held Doppler. So these are the points which help us in order to find that of the pregnancy. So there are some laboratory tests. We can take some sample of blood, we can take some urine analysis in order to check the human chorionic gonadotrophin hormone. So the pregnancy test, that is the hormone, the human chorionic gonadotrophin hormone is secreted by the trophoblastic tissues and increase exponentially from approximately 8 days after ovulation and 6 days after fertilization. Okay, and the peak of this hormone reached to the peak at 8 to 12 weeks of gestation. So this is a very important hormone which help us to make sure the pregnancy. Human chorionic gonadotrophin hormone level can be measured in blood or urine. Test kits are available commercially and can also use at home. Can show a positive result with the urine human chorionic gonadotrophin hormone level more than 50 international units, and some early pregnancy test kits will detect level of more than 25 international unit per liter. So the test will be positive if the urine analysis shows the level of human chorionic gonadotrophin more than 50 or more than 25 international units. These tests can confirm pregnancy within 1 week of missed period. So if the mom is amenorrhea and she don't have any period, so after 1 week of last menstrual period we can find this hormone. Okay, thank you.